It's the game now connected to a public health crisis. Officials confirming someone at this Portland Trailblazers game was highly contagious with measles. The case, one of 26 in Washington. Now, a dozen schools, a Costco, and Portland's airports join a growing list of locations exposed to measles, which can be fatal.
That virus can stay in the air for up to 2 hours after they've left, and if you show up in that time period, again, it's contagious.
Clark County, Washington is home to more than 6,000 public school students not vaccinated for measles. 23 cases of the illness are now confirmed, and that number could explode. Public Health Director Dr. Alan Melnick.
We have not seen any cases in vaccinated people.
The disease is so highly contagious that if one person has it, a person close by who has not been vaccinated is 90% likely to catch it.
When you have measles, you spread it through the air. So the person with measles can leave the room, and 2 hours later, the disease can be transmitted.
Over the last month, those infected told health officials they had visited the Portland International Airport, a Trailblazers home game, Costco, and IKEA stores, potentially exposing thousands. Doctors now worry the virus will spread to other hotspots across the country in large metropolitan areas like Seattle, Phoenix, and Detroit, where families can decide not to vaccinate their children due to personal, religious, or medical reasons.
What we're seeing here is preventable, and if we have one child die of this, that would be a tragedy.
Go. California resident Kelly Kruger wants parents to know what's at stake. Her son Uriah contracted the illness in 2015 before getting a second dose of the measles vaccine.
He was just kind of laying there lifeless for a good few days, which isn't a pleasant experience for any parent or any kid. I would not wish it on anybody for anything.
A spike in measles cases in Europe has killed 37 people since the beginning of 2018. More than 41,000 have been infected. That's nearly double the number of cases all of last year. Experts blame the surge on a drop in vaccination numbers, those who are getting vaccinated. The World Health Organization calling on European countries to take action. Measles is highly infectious and can cause some serious complications, including pneumonia and liver infections. For more on that, let's go to Dr. Isaac Bogosh, infectious diseases specialist at Toronto General Hospital. Thanks for your time today.
Hi, good evening.
We talked about the fact, or mentioned the fact, that this has to do with fewer people, I guess, getting vaccinated. What's behind that?
Well, this is a major problem. I mean, there is a lot of vaccine skepticism, not just in North America, but also in Europe and even worldwide. So infections that really should not exist in communities are starting to make a comeback as fewer people are being vaccinated. We're just not protected against these as we were, let's say, 10 and even 20 years ago. So infections such as measles, and we're seeing, it's part of a much bigger issue. Other infections like mumps, we're seeing more and more outbreaks of this
what we want
globally.
To know, Dr. Nandi here, were the children that were hit by this, were they immunized?
Brian, so of those 16 confirmed cases, 14 of the kids were not immunized. The other 2 were unverified, so we don't really know if they were or not. But I'm really not surprised the number of kids infected is growing, because measles is super contagious. It's spread through breathing, coughing, and sneezing. And get this, the virus can actually hang in the air for about 2 hours after the infected person has left that room. So that's pretty amazing.
Well, anti-vaxxers are now seen as a top threat to global health. And why is that?
Samira, the reason why is that vaccines exist to do one thing, to save lives. And the World Health Organization says that every year between 2 and 3 million deaths are prevented worldwide, which to me is amazing. But that number could be a lot higher. Possibly another 1.5 million deaths could be prevented if vaccine coverage improved. Now, the World Health Organization has named vaccine hesitancy, meaning that folks who are reluctant or refuse vaccinations, as one of the top threats to global health in 2019. And that's because not getting vaccinated could reverse the progress that's been made in really stifling vaccine-preventable diseases like measles. And globally, measles cases are spiking by 30%. And countries that were once close to eliminating this virus have seen a rise in case numbers.
In Clark County, where the outbreak began, 1 in 3 students go unvaccinated. The problem's so widespread, the World Health Organization is calling the refusal to vaccinate one of the biggest threats of 2019, right behind Ebola. And tonight, doctors say even vaccinated adults could be at risk.
Could you live with yourself if your child got another child sick? I mean, really sick, had complications, even death?
I could live with myself very easily. It's a very unfortunate thing that people die, but unfortunately people die, and I'm not going to put my child at risk to save another child. I'm not going to sacrifice the well-being of my child. My child is pure.
Dr. Wolfson followed that with numerous interviews with local television stations and national newspapers.
Are you changing your opinion about vaccination, sir?
So, why doesn't he want to talk anymore? Could it be that he's read the decades of scientific studies showing his position is wrong? Probably not.
Is there an investigation going on?
Yes, there is.
Jenna Jones is the executive director with the Arizona Board of Osteopathic Examiners, the state agency that regulates those doctors.
We open a complaint file, we investigate it, and then we bring it before the board for resolution. All of our cases are confidential.
But we do know 2 complaints filed with the state board come on the heels of Dr. Wolfson's vocal anti-vaccine interviews and calls by other doctors saying amid this measles outbreak, anti-vaccine doctors are a public health threat.
I would like to see them lose their licenses to practice.
Dr. Peter Lipson is a practicing internist and a contributor to Forbes.com, who urged in a column for state medical boards to investigate and pull the licenses of physicians like Dr. Wolfson and 2 other prominent doctors who support a modified vaccine schedule, California's Dr. Jay Gordon and Dr. Bob Sears.
They are doing active harm. As physicians, we are supposed to first do no harm. These doctors are creating harm. They are promoting the spread of infectious diseases, which we should have wiped out by now. This is not only bad behavior, it's dangerous behavior.
Doctors Gordon and Sears both declined to speak to CNN on camera for this story, but publicly continue to say vaccines are a parent's choice, not a matter of public health. Back at Dr. Wolfson's office, the parking lot is full. His office tells us the schedule is packed with patients searching for their doctor's wise medical advice.